To reach a neurological diagnosis is something similar to investigating a criminal case. We have to pick up small cues in the diagnosis from the history taking, from the neurological examination. We have to hypothesize the diagnosis, what could be the possible cause of this particular problem, and then we can do some relevant investigation. So there are 4 steps involved in a neurological diagnosis. Step 1 is thorough history taking. When you visit me with a neurological issue, the first thing I do is listen carefully to your story. This is called history taking, and it's the most crucial step in making a diagnosis. I will ask you about when your symptoms started, how they feel. For example, in case of a pain, I will ask whether it is sharp or dull, or in case of other symptoms, there will be some other questions. And whether these symptoms come and go or stay constantly, what triggers the symptom or what relieves the symptom, your sleep, your diet, your stress, and any previous illnesses or medications. Why so many questions? Because your body gives us clues, and often the diagnosis begins not in a scan but in your words. So don't hold back. Your history is the first piece of the puzzle, and that's the first step which helps me to neurological diagnosis. Now, step 2, neurological examination. After listening to your symptoms, the next important step is a neurological examination. This helps us understand which part of nervous system might be affected. After listening to you carefully, before even I get up from my chair, I make sure that I know what I need to examine and what are the differential diagnoses, what are the different diagnoses which I am thinking of. So during the exam, I will check your reflexes, muscle strength and tone, coordination and balance, sensory function, how well you feel touch, pain or temperature, eye movements, speech and walking pattern, and there are several other things in neurological examination which we decide based on what's the history. History helps us to cone down which neurological examination is to be performed in a given patient. So this step, that is neurological examination, helps us to localize the issue. Is it in the brain? Is it in the spinal cord? Is it in the nerves or muscles? Sometimes even subtle signs can give us big answers. So a thorough exam guides the next step and often narrows the diagnosis significantly. Now, step 3, diagnostic hypothesis. Once I have taken your history and completed your neurological exam, the next step is to form a diagnostic hypothesis. In simpler terms, an educated guess based on clinical reasoning. At this stage, I ask myself, what are the most likely conditions that match your symptoms and findings? Are there any red flags that point to serious or urgent causes? That helps me to decide, whether to admit the patient, to send the patient for emergency department. What do I need to confirm and what must I rule out? This is not guesswork, it's a structured process that relies on years of training and experience. It helps me decide what specific test we need instead of ordering everything and anything. By narrowing it down to a few key possibilities, we save time, reduce costs, and move quickly towards the right diagnosis. Now let's look at step 4, that is diagnostic testing. After forming a clinical impression, the next step is to confirm the diagnosis with targeted tests. These tests help us gather more evidence and rule out other causes. Here are some of the key diagnostic tools we use. The first and common test we do is nerve conduction studies and pseudoscan. These are used to check for nerve damage, especially in patients with numbness, burning or tingling. The pseudoscan is particularly helpful in detecting a type of neuropathy called small fiber neuropathy, which is common in diabetes. The second test is EEG. If you are experiencing seizures, blackouts, or strange sensation, EEG, which is the long form is electroencephalogram, helps to detect abnormal brain activity. It is something similar to ECG. In ECG, we detect the electrical activity which is coming from the heart. In EEG, it is done specifically to detect the electrical abnormalities coming from the brain. And the next test is brain scans, MRI or CT scans of brain. These are used when we suspect stroke, tumors, multiple sclerosis, or unexplained symptoms. They give us a detailed look at brain structure. The next test is blood tests. These help us to find hidden causes like vitamin deficiencies, thyroid dysfunction, autoimmune conditions, or infections. Then comes the vestibular testing with the help of video nystagmography, video head impulse test, posturography. For patients suffering from vertigo and balance disorder, we perform balance and inner ear tests to find out whether the issue is in the brain or it is in the peripheral vestibular system, that is inner ear. Fundus photography. This is a simple non-invasive test to look at the optic nerve head and detect signs of increased brain pressure. Each test is selected based on your unique symptoms. We never do the test blindly. The goal is to move closer to the root cause with precision and clarity. Now, after formulating the diagnosis, the next step is treatment as per the cause. Once the cause is found out, we identify the root cause of your symptoms. The final step is to create a personalized treatment plan, one that's based on science, your diagnosis, and your unique health needs. Treatment in neurology is not one size fits all. It's tailored to what we find. If the problem is related to the nerves like neuropathy, we may start medications, recommend lifestyle changes, treat the underlying cause such as diabetes or vitamin deficiencies. For epilepsy, treatment may include anti-seizure medications, lifestyle guidance, and sometimes EEG monitoring to track the response. In case of stroke, timely intervention is critical. Management involves medications, rehabilitation, and risk factor control like blood pressure and cholesterol. For vertigo, we use a holistic approach treating the cause, and we have variety of ways to treat vertigo like lifestyle modifications, medications, vestibular rehabilitation therapy, repositioning maneuvers, and dietary changes. So the diagnosis, which is guided by the results of the vestibular testing, help us to streamline a plan of treatment. If brain scans reveal tumors, infections, or hydrocephalus, we may involve a neurosurgeon and refer the case to them for advanced care. Even in chronic conditions like migraine, Parkinson's, or memory disorder, we focus on improving your quality of life through medication, therapy, and regular follow-up. The key is we treat the cause, not just the symptoms, and we walk with you every step of the way through recovery, management, and long-term neurological health. If you enjoyed learning about how the brain works, give this video a thumbs up and hit subscribe for more informative stuff like this. Got something on your mind? Drop a comment. We would love to hear what you think.